and this is where I kind of confess a few things about myself and fellow emergency physicians, is that we trained to deal with emergencies, and the reality is not everything that comes into the emergency department is an emergency. You know, gallbladders, traumas, head bleeds, heart attacks, strokes, those sorts of things. Like, those are the things that we get trained for. The reality is, and this goes back to our previous point about healthcare differences, is that people don't have either access or cannot afford to have a primary physician. This emergency department is the safety net for healthcare of our citizens, and folks that live in this country, and we end up seeing a lot of patients for their primary care needs. And I think that one of the misconceptions that the physicians have is that, like, that's not what the emergency department is about. Newsflash, it is. That's what we have to deal with. So we have to like strive to be better in the work that we do, and we have to be able to meet people where they are and be compassionate to them. And healthcare in the US healthcare sector, if it were a country, it would be in the top 15 global emitters of carbon emissions. So wow. It's massive. And so we're not immune to that. So we have a responsibility, again, an inherent responsibility to make the way that we operate more sustainable. So less CT scans, less use of single-use equipment, because all of that has an emissions footprint. So when and then, like, thinking of vehicles, like ambulance vehicles, transport vehicles, we're moving patients back and forward. Where are we getting our energy from to power our facility? Are we like prioritizing using renewable energy to power our hospitals? So it's I don't know. You can't be the part of the system that's responsible for it and not do something about it. You see, even on like places like social media, all the different platforms, you have people that, will get videos from their beds of, doctors and nurses like goofing off and chatting away in the fishbowl, we call it, and saying, what's going on back here? I've been waiting for 2 or 3 hours. Like, no wonder they're taking forever. They're doing all this stuff. Or like patients will say, hey, I saw my doctor once and I haven't seen them again. Like, what's happening? I haven't been doing anything. And I mean, the reality is that when I'm on shift, I might have 7 or 8 patients that are active at one moment in time. And like, my standard workflow is that I sit down, and every time I sit down at my desk, I run my list. So I go through each patient and I look, when are the new labs trickling in? When are the new imaging findings trickling in? I'm looking at their previous chart history. I'm going back, looking through clinic notes, seeing what was done recently, what was done previously, what medications have changed. So patients don't see any of that stuff. They only see you for that couple of minutes often, where you're having a conversation with them about what's going on. I think that, so many people don't understand how it works and what the actual problems are with it. But first off, I would say that the medicine, both in Australia and the US, is the same. We like, human bodies don't change. The medicines that work in Australia are the same medicines that work in the US. And we have amazing providers and physicians here in the US. That by and large, they just try and do the very best they can, and they truly do care about their patients. I think where the difference, like the elephant in the room, so to speak, is that the US healthcare system is for profit, and all of the incentive structure around that completely changes. So obviously in Australia, you have a universal healthcare that is single payer, paid for by the government through the government program, which is called Medicare.
I'd like to at least call myself out on this, because like, going through like perimenopause, menopause, I've been slim my entire life. I've been active. I've never been a person who like overeats, like eats terrible, you know what I mean? But like, like has been like a whole nother world this last 2 years, where I'm just like, I cannot drop a pound to save my life. Like, always, I was a runner for years. I got into spin because I can't run anymore. So I do cycling. And now I'm just like, I actually feel like I'm different, right? Like, so like, I'm like one of those people that like, I am active. I do generally eat pretty well. And so this is actually helping me do something that I have done before, but it's like actually dropping the weight, because I have not been able to drop any weight. And I know that's a midlife thing. So, okay, I might be defending myself here a little bit, but I was like, I need something to like get me off of this space that I literally, all I do, I breathe and I gain weight. Like, I'm like, this has never happened to me in my entire life. And I'm like, this sucks also. And it's not fair.
And I think that there's a couple of really helpful tools that you can use that I think people would benefit a lot from, which we call pre-bunking, so like making sure that like cherry picking is one. So if you know about what cherry picking is it's the type of person that's going to pick out one article and like rely heavily on that article as the evidence for the recommendation they're giving, and when you know about what cherry picking looks like, you listen to what they've got to say, and then oftentimes they'll flash up the study on their screen, so you can just go and search that, and like all of a sudden it's a study on mice, or it's a study on what happens in a petri dish to different muscle cells or something like that. That's evidence. That's cool to understand. But if you're going to make a decision to take that pharmaceutical product and put it into your body based on that, that is totally wild.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube if you want to watch us in action.
You can also find us on social media on LinkedIn, TikTok, and Instagram. Just search Healthcare Uprising to find us. And if you're a new company with a cool new product, if you're someone innovating alternative methods for the health and wellness space, or if you have a personal healthcare journey you'd like to share with us here at The Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. Well, that's all for this dose of Healthcare Uprising. Until the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. This has been a Shut Up production.